Welcome to our presentation that is
All about asthma.
brought to you by
Delta College student nurses.
Learning Content. What is asthma? Signs and symptoms. Who is at risk?
What can trigger an asthma attack? Treatment options and community resources. What is asthma? Asthma is a chronic lung disease that makes breathing difficult. Difficulty in breathing is due to airway inflammation and excessive secretion of mucus.
Our airway consists of the mouth, nose, trachea, also known as your throat, and lungs. Our lungs consist of branches called bronchi. The bronchi further divide into smaller branches known as bronchioles. When having an asthma attack, inflammation occurs in the bronchioles, causing tightening of the muscles. This is also known as bronchospasms.
Now let's talk about signs and symptoms. Common signs and symptoms of asthma include wheezing, anxiety, shortness of breath, rapid breathing, coughing, chest tightness, and or a bluish appearance around the lips, on the fingertips, or on the toes.
Who is at risk? Those with a family history of asthma, obesity, environmental exposure, having eczema, acute or chronic respiratory problems, smoking, and those exposed to secondhand smoke.
Some risk factors for asthma can also cause exacerbating symptoms and can trigger an attack known as status asthmaticus. Now let's talk about some of the causes of exacerbations. Seasonal changes like dry seasons and winter especially, pet dander, infections like pneumonia or the flu, tobacco smoke and secondhand smoke, and physical activity.
Additional causes of exacerbations can be medications like aspirin and beta blockers, chemicals from workplace exposure or environmental exposure, stress, and allergens like pollen, dust, and mold.
Nursing management. It's always important to do an assessment as a nurse, so listening to the lung sounds is important. Noting the characteristics of mucus production, the color and amount, assessing respiratory rate of the patient, assessment of the patient's pallor, also known as color, is it blue or cyanotic, checking cap refill, and checking oxygen status.
As the nurse, we'll want to ensure that the patient is positioned upright. We want to administer medication as ordered, monitor vital signs, review lab results, and maintain communication with the collaborative team. Remember, nurses will have already completed the 5 rights and 3 checks prior to administering any medication to a patient.
Treating asthma. The most common treatment for asthma is albuterol. It's a bronchodilator that can be housed in a metered dose inhaler, aka an MDI or an inhaler for short.
Another treatment is a nebulizer treatment. This can include normal saline, inhaled corticosteroids to help reduce inflammation, and bronchodilators such as albuterol to open up the airways. Oral medications are also included. These are antihistamines and leukotriene modifiers, which are used to treat allergy symptoms. A common leukotriene modifier is singular, and corticosteroids are used for inflammation.
The following video is a demonstration by our fellow student nurses teaching us on how to properly use a meter dose inhaler. Please enjoy.
Hey nurse, what's going on? Hi, it's me, Safe again. I'm here with some medication and some discharge instructions.
Okay.
Could I go ahead and get your full name and date of birth?
Yeah, it's Colleen Ballinger, 06/27/1997.
Perfect. Thank you, Colleen. Any new allergies, Colleen?
No allergies, no.
And how are you feeling today?
Feeling so much better. Oh my gosh, yesterday after that asthma attack and not being able to breathe, but that was awful, but I'm feeling much better. Breathing's going great today. The inhaler helped a lot.
Yeah, I actually have that inhaler here. You're due for another dose, just one puff.
Sweet.
And I'm glad this made you feel better. What it's supposed to do is open up those airways, making it easier for you to breathe.
Oh, okay.
Yeah, and it's called albuterol sulfate. And you may experience...
What was that?
It's albuterol sulfate.
Albuterol
Sulfate.
sulfate. Okay.
Yeah, and with albuterol, you may experience some side effects, like feeling like your heart rate's going up a little. You may feel anxious, a little restless, maybe a little shaky, but those are expected, okay?
Okay.
All right, so I did want to go over proper instructions on how to administer this medication so you feel confident doing it by yourself at home. Is that okay?
Yeah, sweet, thank you.
All right, so what we want to do is first shake the medicine well to mix up the medicine and make sure you're getting a proper dose.
Right.
Remove the mouthpiece here, and then go ahead and put it to your lips, but don't bite it, okay? And then breathe normally until you're ready to administer the medication. When you're ready, go ahead and depress the canister and breathe in slow and deep. Once you've inhaled, hold your breath for about 5 to 10 seconds, and then when you're done, while you're exhaling, I want you to breathe out through pursed lips, okay? And it looks a little something like this.
Okay, so just like I'm whistling or something like that.
Yeah.
Okay.
And you only need 1 dose, but if you were prescribed, let's say 2 doses, between those doses, you would wait approximately 1 to 5 minutes before taking that second dose.
Okay.
Okay?
1 to 5 minutes between puffs.
Yes. And after administration, we do want you to rinse your mouth to get rid of that taste and that dry mouth. Okay?
Okay. Sounds
All
good.
right. Do you feel confident teaching it back to me, and then I can watch you administer the medication to yourself?
Yeah, so I'll just like walk you through first, not actually do it.
Yes.
Okay.
Okay.
Yeah.
Here you go. And I will
Sweet.
put this cup here to rinse your mouth after.
Thank you, nurse. Okay. So give her a shake, 5 seconds, and then breathe in as I'm decompressing the canister, and then hold that for like 10 seconds or as long as I can, and then pursed lips, exhale, and then rinse with water and spit out.
Yeah.
Okay. All right. Go for it.
Go for it. I'll go ahead and take that.
Thank you.
Yeah. All right, perfect. That
was good?
Yeah. Do you feel confident now being able to administer the inhaler by yourself at home?
Yeah, that's pretty easy.
Awesome. Any questions for me, Colleen?
No, thank you, Safe.
All right.
Hey, nurse, what's going on?
Hi, it's me, Safe again. I'm here.
These are some community resources that can help you to manage your asthma symptoms. Central California Asthma Collaborative, or CCAC, began conducting home visits to help low-income families reduce indoor environmental triggers and learn how to use medications properly. This was achieved through the use of CARES, California Asthma Remediation and Education Services. Facilities are conveniently located in Bakersfield, Fresno, and Modesto, California. The CCAC also has a Facebook page providing scheduling for online Zoom calls, and the link is listed here.
Another community resource also operated by CCAC is SJV Air, which is a free downloadable app that will inform you on air quality across the San Joaquin Valley and is available to most smartphones. Our resources page also has the CCAC's website link listed below. Thank you again for joining us today for All About Asthma.